Bismillahirrahmanirrahim. Good morning, ladies and gentlemen, and assalamu alaikum. My name is Dr. Noor. I am a postgraduate resident at Mughal Eye Hospital, and today I will be discussing about artificial intelligence in ophthalmology, a paradigm shift. I declare no conflict of interest for my presentation. So if you see this picture, on the left-hand side is a normal vision, and on the right-hand side is a vision of patient of diabetic retinopathy. Diabetic retinopathy is considered to be one of the leading causes of blindness worldwide. And in Pakistan, the cases of diabetic retinopathy has been increasing at an alarming rate. According to the International Diabetic Federation report, there was a 14.93% increase in the cases of diabetic retinopathy from 2016 to 2022, out of which a significant number of people belong to rural areas where there is a high possibility that the patient goes undiagnosed and remains untreated. So the delay in diagnosis and untimely intervention is because of our overburdened healthcare system, shortage of skilled doctors in rural areas, and long delay in reporting the results of fundus images. So we all know every problem comes with a solution, and the solution to this problem is the use of artificial intelligence. AI-based diagnostic system can assist the doctors and medical staff in basic health units of rural areas in early diagnosis and referral of the patients to advanced tertiary care facilities where further medical facilities will be given. So the purpose of my study was to develop a diagnostic system to screen the patients with diabetic retinopathy at an early stage based upon the infrared fundus images, so as to refer the patient to tertiary care centers, and we evaluated the accuracy and reliability of our machine learning algorithm. Ethical approval was taken. It was a diagnostic accuracy study for AI model. It was basically a multi-centered study in which 400 retinal images were taken from consecutive patients attending a routine annual diabetic visit between February 2023 to October 2023 in 3 major centers in Lahore. Our inclusion criteria were diabetic patients coming in the OPD between February 2023 to October 2023, fundus images of the patients with type 2 diabetes of more than 5 years, and patient had no other retinal disease. All the patients with the media opacities that were sufficient to blur the details of fundus were excluded from the study. These images were manually graded according to the International Clinical Diabetic Retinopathy Severity Scale by a vitreoretina specialist having a clinical experience of greater than 10 years. In the first stage of our study, the system was first trained with different fundus images as having diabetes or no diabetic retinopathy. And once we thought that our AI system was trained, we tested our model with 170 original raw images model. Out of these 170 images that were shown, 67 were normal and 103 had diabetic retinopathy. Results from the stage 1 showed an accuracy of 0.76, a sensitivity of 0.77, and a precision of 0.84. In the stage 2 of our study, we took a further step ahead and we pre-processed these images before showing it to our AI model. Our design algorithm was designed to segment the vessels for neovascularization using a green filter and to segment the images for hemorrhage extraction. As in this picture, you can see the retinal images were taken, data acquisition was done, images were pre-processed and was sent to the model, which classified it as normal or having diabetic retinopathy. Image enhancement for the detection of neovessels, you can see on the left-hand side there is no clarity, but when we applied the filters, and we can see the increase in the clarity and the hue. The results from the stage 2 showed an accuracy of 0.88, a recall of 0.86, and a precision of 0.91. When we compared the raw images with the pre-processed images, with the VR surgeon, we achieved a precision from 0.78 to 0.91. As you can see in this picture, that the pre-processed images and the raw images, there's an increase in the precision from 0.78 to 0.91, and an accuracy also increased from 0.77 to 0.88. So we have achieved an excellent sensitivity for referable retinopathy compared with that of human graders, and this is undoubtedly the key finding of my study that translates into certainty that no patient in need of an ophthalmologist is misdiagnosed as negative. If we can use a smartphone-based fundus photography, it can revolutionize the screening of diabetic retinopathy, and it can help in the early detection, timely referral, and proper management of patients of diabetes, and it can ultimately save the sight. So the take-home message from my presentation is we are moving towards a paradigm shift. The use of artificial intelligence in medicine has promising results in future, and it can ultimately benefit the patients in all possible ways. Thank you.
Dr. Sir, can you please tell us how were you getting all these images for this procedure?
Yes, sir. This is basically a multi-centered study in which my unit, Mughal Eye Hospital, Lahore General Hospital, these images were taken from we basically handpicked the patients from February 2023 to October 2023. All those patients that involved in our inclusion criteria with diabetic retinopathy greater than 5 years and no other retinal diseases and media opacities that were not sufficient enough to do blur the details. We took these patients, took the consent of these patients, and took the fundus photographs in our setup.
No, I was just asking what was the method of taking these pictures?
What was the method, sorry?
What was the method of taking these pictures from the periphery?
Sir, I don't get.
How were you?
The question is, how were the fundus photographs being taken?
Sir, fundus photograph was taken from the fundus camera.
Which one?
Yes, sir?
You mentioned handheld fundus.
Sir, this is basically the study in which we have done that the AI model is sufficient enough. Now, if we want that this system is being implemented in the rural areas where we have to use this fundus camera in order to revolutionize the patients of diabetic retinopathy.
Thank you very much.
Can I ask one thing?
Yes, ma'am.
That you want to take it in future in the community.
In the community, in the rural areas specifically.
But at this time, you are using the fundus camera, not the smartphone one.
No, we are not using the smartphone right now, but we wanted to implement in such a way that we can combine it with the fundus-based photography. What we want to do is that we want to create a software and an application that will be installed in here, and the software will be installed in that application, and we can basically implement it in the rural areas where this combined with the smartphone-based fundus photography, the people, medical MOs, they can use using this AI network, they can tell that the patient had diabetic retinopathy or no. So if the patient had diabetic retinopathy, they will refer us to the tertiary care centers where we ophthalmologists will deal the patient.
Okay.